I think the way I think about costs of drugs is they're so heavily inflated by some parts of the pharmaceutical industry and the lack of necessarily a sensible approach by government. The way I try to think about it is a drug a breakthrough and will it make life easier? And then when the competitive drug becomes available, as they always do, the prices come down. It's always tough to be at the front end of receiving a new drug because the costs are so artificially inflated. At the end of the day, if you think about the costs engendered by, say, Lupron or equivalent, and the associated medications that go with it, they will be cheaper than a new orally administered drug just because that's the way the system works. But it's not necessarily what should happen. So it's a shame to make a patient get a shot in the abdomen every month, 3 months or 6 months, when there's actually a tablet that you could take that would make life easier and would avoid the need necessarily to come frequently to the doctor's office. I think everybody in oncology knows the system we work in is pretty crazy and has a lot of inappropriate nuances that relate to cost containment. Eventually, I think that will change, and it is what it is. What I do think is that we need to be aware for all the work we do of what patients pay out of pocket when they're insured. The whole system is kind of messed up at the moment. And it's kind of a tragedy to have a potentially important new drug where well-intentioned physicians won't use the drug because it's simply too expensive. It creates a class disconnect. The wealthy can buy the drug and the poor have to show up and get shot up. One of the other sad things is the lack of penetration of the 6-month depot preparations of drugs like leuprolide. The reality is there are physicians who will bring people in every month to get a shot because they can bill for that. With degarelix, as far as I know, there isn't a depot preparation, so there you have to use that drug regularly. So I think it's a sad fact, but a reality of the world we live in that we as physicians need to look at what is the best drug, and then the reality of the lives that we lead is we sometimes don't get to pick the best drug because of cost consideration.